How's it going? My name is Jeff and I'm a licensed occupational therapist practicing in the United States, and I go by the moniker OTDUDE. Today I have with me my friend here, Mr. and I'm going to go over how to help a patient get out of bed in this caregiver training series for you, the caregiver. So I'm gonna basically just give an overall overview of how to do this. I know each and every patient's needs will be different. They have different kind of strengths and weaknesses. And of course, the environment that you'll be helping the patient in may be different than mine. But here I have a pretty typical setup. This is a queen size bed and I have a patient basically in the center here. And before I even get the patient up, I like to tell people that I train, like the families, friends, that planning is really the key to helping the patient, planning ahead. Because the last thing you want to do is get the patient up and then find out that you forgot to maybe move a chair out of the way, or there's like a dog like in the way of the patient, and there may be a need to rush or the urge to rush, like a patient may have to go and use the bathroom or something. So the last thing you want to do is, and by the way, you shouldn't rush. So the last thing you want to do is get stuck in those situations. So even if it takes a minute to plan things, either by doing a walkthrough, like physically, or by just thinking through in your head, that can save both you a lot of headache and the patient a lot of trouble too. And it can be pain, fatigue, anxiety, whatever. All of these things maybe even like added together. So if you can avoid these things, that can give the patient more confidence in you, the caregiver, because it's just like how I should look like. I know what I'm doing on the job. You should look like what you're doing, even if you have no idea. So here are some scenarios. Why would a patient want to get out of bed? Well, maybe they're tired of being in bed all day and they want to go and sit and go into another room. Okay, so is the other room ready, for example? Are things out of the way? Is there a chair ready for them to sit in? Is it the best chair that you have in the house for them to sit in? And not only thinking about how to get from point A to point B, but from point B back to point A. So for example, from the bed to the chair and back. Or it may not be necessarily back to point A. It may be from point A to point B and then point B to point C, say maybe sitting in the wheelchair, or maybe sitting in the bathroom, and then from point C, ultimately back to point A. So you see how, even though I'm just trying to get the patient out of bed, the situation and the complexity have just multiplied, because maybe the patient may not want to go back to bed and plans may change, because we're all humans and things are dynamic and we change our minds, right? And that's okay. Even it's not like, oh, whoa, mister, I'm sorry, but I didn't plan for you to go to the bathroom, so we're gonna just have to go back to bed and you're just gonna have to pee in bed, or so give the patient their dignity, their autonomy, and their confidence, and empower them to do the things that they want to do to increase their independence, because most patients probably don't want to have someone help them or rely on someone else. They want to be independent as much as possible. So what are some other situations? I mentioned the bathroom. That's pretty common in the middle of the night. We're kind of trained, like I'm potty training my 2-year-old right now, and I'm teaching him to like not pee in bed, right? So we've been conditioned and trained from a very young age, and if we can help it, at least if we have some continence, that is, we don't have an accident in the middle of the night, we try and go to the bathroom, right? So that is another reason, especially the elderly, they want to go and use the bathroom, especially in the middle of the night. Even for me, like if I drink a lot of water, like before bedtime, I find myself that I have to go and wake up in the middle of the night to go pee. So it's pretty common. So what's another reason? Maybe to get dressed and go to an appointment. Maybe to get your hair done, maybe to socialize with friends, to go out, get some fresh air. Like who wants to be in a room all day, right? So there are a lot of reasons, but you can really just plan ahead of time. So if it's to go out, okay, do I have the clothes that they want to have to wear ahead of time? So if there's like a closet here, I'll like point it out. Like, what can I help you get, mister, to get dressed before we get up? So that they're not sitting up in bed and they can't, maybe let's say they don't have a very long tolerance for sitting up in bed, then you're all trying to find clothes for them, and if they get tired, then you have to help them back and lay back down. And so you're doing multiple moves and efforts and doing a lot of back and forth, and that can add to you too, the caregiver, in terms of your fatigue, because everyone has like kind of like a smartphone. We have a battery that's fully charged, and it kind of drains throughout the day, and you have only so much power or energy, and say the patient, they only have so much energy, and if they didn't get a good night's rest, they may say they had a lot of pain, or they were really restless, they were really anxious about their doctor's appointment the next day, they didn't get a lot of rest, or they didn't get their medications, or the medications aren't strong enough, whatever the reason, then they may not get a full charge for their battery, so to speak. So they may have even less to work with. So you should keep that in mind too, is how much can the patient do, and you want to maximize what they do, but also plan ahead so that you're not wasting energy and doing things like draining their batteries, such as like leaving the screen on the phone. That's equivalent to like leaving them sitting up or something, and you're just like trying to figure things out. So that's my hot tip for you guys, and the pro tip is to plan ahead. Before you get a patient out of bed, another important thing you should do is look for obstructions or things that may get in your way. Pretty intuitive too, right? But let's say the patient's like under covers, you really don't know what's going on too, right? If you're not the only caregiver, let's say you have someone else, or they have a hired caregiver that comes and they take care of them, you don't know what's really going on. So kind of tacking on to point number one of planning ahead is also just to plan the environment too. Even if you have everything planned in your head, just double check to see. A good example is the bed. This is a regular, just a typical like bed that you can buy and have in the house, but the patient that you may be working on may be on a hospital bed. And some hospital beds have brakes on them, meaning you can unlock it and they may be on 4 wheels. So an example is, and to check the bed to make sure it doesn't move. So that just takes a second. I could just nudge against it, push against it. Okay, very good. This bed isn't going anywhere. Check. If it helps, maybe have a checklist. You can even post a sign on the wall, like lock the brake. If there is a brake and you know you're probably gonna forget one of these times, like when you're really tired in the middle of the night, you know you're not gonna be on top of your game. Even though as you try to be as best as you can, we're all human, right? So try and use things to your advantage, like write things on the wall or like steps. So the brake. Another thing are like lines and cables. So what I would do is, hey, mister, let's get you out of bed. And you said you wanted to get up in the chair and sit and watch Jeopardy. So let's go ahead and do that. But first, is it okay if I just check to see what's under the covers to make sure there's nothing like blocking us? Okay. So let's do that. I want to pull back the covers and look what we found. These are pretty common charger cables. So I'm gonna get that out of the way, right? Last thing you wanna do is get tangled up in a cord when you're moving the patient. I also see in between the knees some more supplies. So the patient's knees, that is. So move that out of the way. I'm just gonna do like a head to toe check is a pretty good one, right? From head to toe, look, see, okay, nothing else. Foley bags are pretty common. So a clue is basically like a tube. It kind of looks like those, if you remember, if you ever had fish and you change the tank for the water, it's kind of like those similar tubes, and it's kind of clear, and it runs from the leg and it leads from the groin, and it usually runs down the leg, but not necessarily, and then it leads to a bag. So those are usually like on the side of the bed, like they have like a hook to them, and they're usually hooked on like the side of the bed. Or sometimes it may not be the case. It may just be at the foot of the bed, or it may even be in bed. So basically, to drive home the point, check for things around the body. And for example, if there is like a Foley bag for like the urine, then you're gonna wanna bring that along because you're not a nurse and the patient needs it for some reason. So you can't like disconnect it, and you should never disconnect stuff from the patient. Plan that ahead. So an example may be that the bag for the Foley for the urine is on this side of the bed. Then if I were to help the patient get out of bed, and I forgot about it or didn't notice it, then it would snag against them. And these things are connected to the patient's groin. So they're not gonna have a good time, and they're gonna be kind of upset with you. So what I would do is, if I saw like a Foley bag on that side, I'm gonna pretend this is like a Foley bag, I would basically bring it over, but remember gravity, right? It's not a good idea to hold it like this because the urine will flow back down the tube and back towards the patient, right? So if I were to move a Foley bag to the side that I'm helping the patient get up from, try and keep the bag as close to the patient's like bed level as possible. So it would look like this. So let's say it's connected to the patient, right? Here's the bag. I would just kind of bring it across like that. So from here, I have basically many things I can do. I can clamp it to the bed, but if I want to help the patient get up, then I would kind of get stuck anyways. If they have like a wheelchair, then that's a really great thing because then I can actually put this bag on the wheelchair and that'll come along with me and I won't forget it. So as I am doing this step, then I am kind of one step ahead of the game because I'm not going to get stuck. Another thing is, let's say they have a walker. A walker has like a kind of like a horizontal bar, right? So I can hook this onto the walker. So you see what I'm saying is to put the Foley bag on the surface or device that the patient is ultimately going to go to. If the patient doesn't use anything, like they just walk and they just need kind of like a hand hold assist kind of thing, like you to kind of be there, then you can hook it onto them. Like if they were wearing like, oh, I don't know, like a nightgown or something, maybe they have like something you can clamp it to, like a pocket. Basically, what I'm trying to say is when it comes to caregiver training, I can train for one situation, let's say in the hospital, but environments are different. Just like how your patient is in the home that you're in or wherever environment you're in, and the situation may be different. So that's really going to be up to you to really use your problem solving. And this is why I say planning ahead is so important, because I can't train you guys for every single situation because let's say the bed is flipped around the other way or something, right? So then the steps will all be changed in terms of how you would do it, like in the direction and stuff. So I really highly encourage you guys to problem solve ahead of time and not rush. Because, if the patient is trying to rush and use the bathroom, but the other option is to rush and be unsafe and have something happen, then obviously it's safer to take your time and plan ahead and not have like a fall or an injury and just maybe suck it up and clean up a mess, say from urine or something, right? Yeah, it's not the greatest in having to do that, but it's better to avoid calling 911, right? So that covers the Foley. That's the most common thing that I kind of bring along. Another thing is, oxygen would be pretty common. Yeah, a lot of patients are on home oxygen too, right? So they may be hooked up to like a machine, like a concentrator. You can't miss it, it's really loud. It sounds like a very loud pump. They're connected to, usually if they have one of those, they're connected to two things. The most common probably would be the nasal cannula, and that's kind of like the tube you see in like medical TV shows and soap operas, like that's connected from their nose and it hooks around their ear, and then it kind of looks like a set of like old school headphones, and then it kind of leads to a tube that connects to that device. So think about that. If you're going to help the patient get up, what are your options? Can you disconnect them momentarily, let's say to go to the bathroom without oxygen? Like, will they do okay? A lot of times if you can talk to the patient, they'll probably know. They'll be like, hey, like, mister, it looks like we have a tube connected for your oxygen, but I don't think it's going to be long enough to go to the bathroom, nor would that be safe. We would probably trip over it. So would it be okay if we disconnect it for a couple of minutes and then put it back on? Okay, good. What if they need to bring it along? Well, in those situations, you have two options for having the patient remain connected on oxygen. One is to switch over to like a portable system. So maybe they have like an oxygen tank and you can switch them onto that, and that's a little bit more portable. Some are like kind of like very small and you can have it like wear it kind of like a purse, or sometimes it could be a larger tank. Or the other option is to have, if the patient sometimes has really long tubing and you guys are very careful, although I'm not a fan of it, they can remain hooked up if you use longer tubing and kind of like Christmas lights, string them really long. Just be very careful not to trip over them. So see what I'm saying? Like how even just one little thing can add to the complexity. So this is not to really give you guys more anxiety or to intimidate you about being a caregiver. These are just like real world things that we're not used to, right? So we're used to like cords and not tripping over it, but we don't think about oxygen tubing. It's just another thing to think about, and the more you do it, the more comfortable you'll be. So thanks for watching. I hope this video helped, and I will see you all in the next one. Take care of yourselves and have a nice day.